Hello and welcome to this edition of CG Podcasts. My name's Toby Green, and it's a great pleasure today to welcome to CG Podcasts Dr. Reginald Oduor from the University of Nairobi. Reginald, welcome to CG Podcasts.
Thank you very much. Very kind of you to have me today.
Well, it's great to be talking to you, and we've been in discussion for quite some time about the impact of COVID policies in the last 2 years on Kenya. So it was great to be able to talk about that in more detail. Perhaps you could begin by explaining to our viewers and listeners about your academic background and what first drew you to become interested in the policy response to the COVID pandemic.
Thank you. I'm a political philosopher, so to speak. I teach philosophy at the University of Nairobi, have done so since 1992. With a special interest in ethics and political philosophy and African philosophy and philosophy of religion. So the issue of the COVID measures touch on civil rights. They touch on some important aspects of our liberties, human agency, human dignity, bodily autonomy, informed consent. And they also touch on wider social justice issues, such as how the underprivileged are handled. And so that then is squarely within the ambit, so to speak, of my interests as a political philosopher and an ethicist.
Thank you very much. And that clearly shows, I think, to everybody who's watching and listening to this, just how central your research is and the insights you'll be able to give us about what's been happening in Kenya in the last 2 years. But perhaps we can start right at the beginning of the pandemic in March 2020. When the initial lockdown measures were implemented, I know that some Kenyans already were saying this is not suitable for the Kenyan environment. For example, a colleague who teaches here in the United Kingdom, George Agola, wrote a piece about this for The Conversation. But I wonder, how did you respond initially? And did you share those concerns at first?
Well, at the beginning, we were all terrorized, not knowing what this new thing is. But soon after, we started noticing that the responses were draconian. And that became a matter of concern to me very soon after we had our first reported infection. I wouldn't call it a case, but rather an infection in mid-March. And I started to get worried about how things were going.
Yes, and did you? Because I know you've written a number of articles. And did you initially publish? Was there debate in Kenya about this? Were you part of that, or some time to develop?
Well, I think that took some time to develop. There's a lot of discussion on on WhatsApp, for example. Mm-hmm. People trying to figure out where did all this come from, and is there a hope of getting out of it? Mm-hmm. But generally speaking, I think at first it was shock and almost people, what would you say, cowering into corners and wondering what will happen. But then, every evening there was this reading of figures. And I guess that made people feel so helpless as the figures went higher and higher, yes.
Mm-hmm. And can you describe then, so we have a sense in the beginning there was a real panic in Kenya. And then it sounds from what you're saying that quite soon people began to develop a different perspective. But what can you talk us through what the initial government response was? I mean, the lockdown, yes, but school closures, for example, closure of hospitality, these kinds of things, the informal sector, and also how long those measures continued for, at least to begin with.
Well, the first COVID infection, as I said, was in mid-March 2020. And at first, the government enforced the so-called social distancing measure for some weeks, and then a series of lockdowns and curfews, as well as a mask mandate. The strange thing was I actually heard the Minister for Health saying, we know that these cloth masks don't really work, but wear them anyway. And the police came down hard on citizens who did not make it home in time during the curfews, despite the poor public transport services. And burials of people whose deaths were attributed to COVID were done under the strict supervision of security and public health officials. And in several instances, people were buried by security personnel without the involvement of their kin. So the initial COVID waves were, quite frankly, not serious in terms of the numbers, but because the daily infections remained pretty low, and for months we hadn't even hit 100 deaths, just being told of cases, many of which were not really cases but infections. So then,
So this went on for a number of months. Then this kind of situation of very severe restrictions, but it not seeming to map onto daily experience.
Exactly, precisely. We had lockdowns, and yet when I looked at the numbers, and I'm not the best with numbers necessarily. My training is not statistics or anything, but the numbers compared to the population were very low. The number of infections were low, and the numbers of deaths were even lower. But of course, hearing the figures every night made people feel helpless. Yeah.
Yes. I mean, and it's interesting what you just said. I mean, you mentioned that people were buried without their kins even being present or allowed to go to the funeral. And of course, in many African societies, a funeral is an extremely significant, well, in all societies, a funeral is an extremely significant event.
Yes.
So, I mean, I was thinking as a philosopher and as somebody concerned with ethics, that must have been one of the features which really began to alarm you.
Yes, indeed. Because for me, it cannot be that health is about not catching a virus. Health, even the World Health Organization says, is a state of complete
social, complete physical, mental, and social well-being.
Social well-being. And here people are just focusing on the physical. So that became a problem for me.
Yes. And you say that initially there was discussion on WhatsApp, which is, of course, a way in which a lot of people communicate all over the world, but particularly on the African continent. But were there any more formal discussions about the policies? Did the opposition, for example, contest any of these decisions? Was there a political discussion of any kind?
Well, our various, you see, what is happening is people are discussing on WhatsApp, a little bit on Twitter, but both the government and the opposition are not differing at all. They both seem to agree we have a big crisis and let everybody comply.
Yes.
Yeah.
Yes. So we can start with so you say the initial wave was not particularly serious, but yet at the same time, it was very strictly enforced by the police. Could you give us some detail about that? I mean, for example, there are obviously large informal settlements in Nairobi, for example, in the big cities of Kenya. Did the police even were they trying to enforce measures even in those large settlements which they may not have such great access to as other parts of the city? How strictly enforced was this across the country?
Well, what I picked up is that on our public transport, particularly the enforcement was really, really ruthless. Mm-hmm. In one of our biggest informal settlements, I got to understand that in there, the police could not dare, because the people are many and are not happy to be bullied. So in there, they live their lives normally. But once you get out of there, then you meet the police.
But I suppose economically, the informal settlements are, of course, dependent on being able to access other parts of the city in order to do informal trading, to work in various sectors of the economy, which they can't work on so while they were at home, it may not have been easy to enforce, but everybody was touched by this in some way.
Precisely. I mean, they were in there, but they couldn't go out and work. And a lot of them earn their living literally on a daily basis. If they don't go out, they have nothing to eat for that day. And so the lockdowns were a problem. Only that some of the lockdowns, to be fair, were interesting in that there was a lockdown that would say, don't get out of the capital city. But inside the capital city, you could move around. So they could go to the factories and work and get some money. But they couldn't go to other towns. And some of them are traders who need to do that.
And I suppose that must also have impacted farmers, because farmers need to be able to bring their crops into towns, into cities to trade. And if they were not allowed, if there were quarantines around the cities, that must have had an effect as well.
Yes, it did. Although, again, to be fair, the government did allow people to send over foods by buses or lorries without being there personally. So, in other words, if a trader in one end of the country had contacts at another end, they could put their cargo on their consignment on a bus or a lorry, and it comes over and then it's picked up and sold. So, yeah, but still some people don't have that much sophistication. So
that requires a certain amount of social capital to be able to do that.
Yes, indeed.
Yes. So, I mean, that gives us a sense of the general picture. And I mean, obviously that's impacting the informal economy particularly. You know, that obviously Kenya, you know, like most countries in the world and obviously in Africa, is, you know, very much there's a huge amount of inequality economically. There are some people who have resources and who were able to work at home, and then there were others who were not. Did the government, I mean, in many countries, some kinds of schemes were developed to try and provide food to those who weren't able to work and some form of income. But did that happen at all in Kenya, or was there no real government support when people's livelihoods were upended?
There was an announcement of such a measure, but since I did not inquire deeply into it, I guess it would not be very fair for me to speak too much about it. But some people were complaining that they never saw the aid. But quite frankly, I did not research that deeply, so I wouldn't say that much.
Okay. I mean, if we talk then, in general, the impact of the restrictions in the first year,
yes,
it seems people in particularly in the informal settlements and in the poorer sectors of Kenyan society were badly affected. But as time went on, in the last year, since 2021 into 2022, have things recovered back to how they were before COVID-19?
Well, I don't think they can really recover that fast. But towards the end of last year, a lot of restrictions were removed, particularly the curfews and the lockdowns are no longer there. And therefore, the most underprivileged are able to get on with their lives. I think that the issue of travel for those in the middle classes who travel out of the country and so on, that's where it gets tricky if one were to decline the so-called vaccines. That is where now the rubber meets the road for them. But otherwise, a lot has come back to normal. Schools are open, colleges are open, face-to-face classes are going on. Yes.
Well, let's talk about education. I mean, obviously, there was a big impact all over the world on that. And obviously, in universities, you know, in Africa as elsewhere, there was a hybrid approach, or, you know, some students were in the classroom, some were not. Obviously, that is a big problem in countries where many people don't have enough data to access resources and materials. What was your experience of that?
With regard to education, the schools were closed for very long. So in fact, now that they are open, the government has a plan where children are supposed to cover large chunks of content in shockingly short periods of time, so that they can try and catch up, so that by next year we go back to the normal calendar. Also, because the kids stayed at home for long, those who are underprivileged and could not have access to the internet did not learn during that period. Those in the middle classes who have Wi-Fi and who can buy what we call data bundles for their mobile phones could get on with their lives, could get on. And also, while the kids were at home, there was a lot of child abuse from kin and from neighbors. So the devastation was major. At the university level, we have had online exams, but there are those who feel these haven't been well planned. So that, for example, the quality of questions that are set are a challenge, because if one doesn't set very good questions, then the students easily just go onto the internet, copy and paste. These require much more creativity if one is to examine anything. So those are some of the challenges.
Some of the challenges. I mean, can I just ask for a bit more detail? You say the schools were closed for a long time. I mean, I know in neighboring Uganda, they were actually closed for 2 years. But how long was that in Kenya that the schools were shut for?
Well, I think most of 2020, they were closed. Then at one point, they opened them, and then they said there is a wave. The figures are shooting up, then they were closed again. So I would say a good portion of 2020, the schools were closed. And then at the beginning of 2021, they started opening them. So our closures were much shorter than Uganda.
Much shorter than in Uganda. But,
yes.
But one thing you mentioned, I mean, one thing which has happened in many countries is, of course, a lot of children have fallen out of the education system and probably will not return. I mean, I think in Uganda, I think the estimate is 20% of the children. I don't know. I mean, obviously, you probably don't have a figure, but has a similar pattern been observed in Kenya?
I haven't had as much talk of them dropping off completely. What I do know is I have heard our Minister for Education, who tends to be quite proactive, saying that they are doing all they can to trace all the children to ensure they are all back. And he was my vice chancellor before, so I do know he has a lot of drive when he says things like those. But as to whether he'll succeed is quite another matter.
Yes, well, I mean, yeah, of course. And as you say, there are lots of other issues in terms of how people had access to the materials and whether they had access to the materials as well. Well, I mean, Reginald, you're a philosopher, you're an ethicist. You know, you as you said at the start of our discussion, you know, there are lots of issues in terms of civil rights that really drew you to be concerned about this and to be quite outspoken as well. So how do you reflect on the experience of the last 2 years in Kenya? Do you feel that the balance between civil rights, social rights, rights to an education have not been obeyed or observed?
I have been concerned, particularly about the underprivileged, who really suffered through the lockdowns. And yet, the amazing thing is where they live, a lot of them in the informal settlements, there is no way they could ever observe social distancing. And yet the deaths there were not amazing. There was nothing exceptional about the deaths in those informal settlements. And yet they were being told how they have to keep distances out here. And yet in there, they were not keeping those social distances. And there was no outbreak. And yet now they could not eke out a living as they were doing before. And that is pretty serious. Again, the right to health was violated in the sense that a lot of children missed their regular attention in the clinics, postnatal and all this kind of care, because travel was difficult with lockdowns. People with HIV/AIDS missed their retroviral drugs because of the obsession with this new virus. I know in African culture we treat visitors well, but now this visitor virus was getting more attention than things that have tormented people for years and continue to do so. So that was particularly disturbing. And yet another matter of grave concern was when the vaccines were made mandatory. And people were told, if you don't take the vaccine, you can't get into a supermarket, you can't get onto public transport, or you can't get into a government office. And I think that really violates the right to informed consent.
Well, Reginald, you've raised several issues there, which I think are really important in terms of health in particular. And firstly, I mean, some people have said, for example, there's a doctor in Sierra Leone who suggests that the lockdown model is actually counterproductive in African situations, because, of course, in informal settlements, many people spend a lot of their time outside. They don't tend to spend a lot of time inside. Do you think, you mentioned that the virus did not have a big impact in informal settlements. Do you think that might be one of the reasons, because of the reality of daily life away from lockdown models?
I don't think so, because however much they went out there to eke a living, they came back home, usually because of the curfew. They may be home at 7, and they're not going to retire to bed until 10, 11. They are going to the water points and meeting and chatting. They are hanging out together in the evenings. And the infection is not getting higher. Actually, I personally think, and I'm not a medic, that the suitable weather here is a factor that people have somehow refused to acknowledge. Yes. The fact that viruses, and not just the COVID one, viruses tend not to flourish in warmer weather. And yet this one-size-fits-all intervention with its origin in the Northern Hemisphere was quite frankly unnecessary here. I remember talking to an American lady who I was discussing with this issue, and she was categorical. There is no way Kenyans and people in Africa will die en masse because they eat wholesome food, they have good weather, they walk a lot. So it's not going to happen. She wasn't.
And of course, the other issue is, of course, the population is much younger.
Precisely. And then the population is young, and yet this thing hits the very elderly, not even the elderly, but people over 80, I'm told, are the ones who are really, really at risk unless somebody has serious underlying conditions. So there was this intervention that really might have fitted the Northern Hemisphere, but nothing was totally inappropriate for our overall situation.
So that's one very important issue. And then, you also mentioned the issue of vaccine passports or vaccine requirements. I think Kenya was the first country in Africa to bring that in.
Yes.
Was there any debate about that at the time in the media, or was there any discussion? And again, was this enforced in informal settlements, or was it just in the city?
Actually, I will start with your last question. It was mainly enforced in supermarkets and in the kind of places the middle class would go.
Okay.
Those who buy their essential commodities from little shops and so on had no problem at all. It's only during the December holiday season, those in the middle class who wanted to enter a supermarket or to take a flight, there would be a desk where you're told, oh, you're not vaccinated, walk over to that desk and get vaccinated, and then you can board. That is extremely manipulated, and it happened a lot. after the holidays, the announcement has come again and once or twice that the vaccine mandate is still in place and is being enforced despite a court order, but we'll come to the court issue later. But in practice, the enforcement has really, subsided substantially.
And what about on the university campus, for example? In quite a number of countries, you needed to be vaccinated to go onto the campus. Is that the case in Kenya?
No, in this part of the world, I haven't had any such thing.
Okay. So those were two of the issues that you've raised. But another very important issue that you raised was the impact of the COVID focus on other medical conditions, particularly the ones which are most, affect the largest number of people in a country like Kenya, such as HIV, routine childhood vaccinations. Now, I know that in a lot of countries, for example, in Mozambique, I know that those vaccination programs, the routine ones, are still. It was described as stagnant. They haven't restarted. How has that been in Kenya?
Here, I have not gone out to verify in every detail, but I think operations in this country in terms of medical care have largely resumed. The figures in the evening are no longer being read because they say that the infection rates are very, very low, and the hospital beds don't have COVID-19 patients. So as far as I can tell, medical care services have largely resumed now. But in the height of the lockdowns and the curfews, it was a challenge.
It was a challenge. And what has your experience been like as somebody who is visually impaired? Has it had an impact on things for you?
Well, when the lockdown was enforced, my driver came to work, but had to dash before curfews. But I would say that, stretching your question beyond where you asked it, that a lot of people with disabilities really had a hard time with the lockdowns and the curfews. Imagine somebody who has given their caregiver 3 days leave to go and check out something in another county, and then the announcement is made that there's a lockdown because there was never a warning about the lockdowns, and sometimes there was no grace period before they were enforced. So the helper is stuck in one county, and the person who was holding fort cannot continue to care for the person, so they're on their own. That happened, and I also know, I know I'm being extremely naughty and going beyond your question. I know a man who could not nurse his dying wife. She was dying of cancer because he was in one county and she was in the other. And they could not be together for a very long time. So those kinds of situations were there. But I guess because of my social class, I worked from home, I taught online, and so on. I must admit that the effect was not as big on me in that sense.
Okay.
Yeah.
But it clearly, again, impacts, the stories you've just told us, impact enormously on people's civil rights, which, as you say, is something which greatly concerns you.
Yes.
So, I mean, when we look at all these things, let's come back to this question of the philosophical, ethical questions about what happened. Now that 2 years have passed, and as you say, there aren't really any COVID-19 fatalities, the country has kind of moved on more or less from the disease. Is there now a space to discuss the response and the impacts that it had in Kenya?
Well, I sense, firstly, I would say that when the vaccine mandate came in December, there was quite a flurry of activity on social media. A lot of people who hated the mandate spoke up on social media. I was busy with that particular discussion. And some of the posts were very angry. In the academic circles, I don't get the sense that people have really focused on the injustices that were unleashed. The focus still is very much the conventional, what what to do when there's a pandemic. And I think a lot of academics seem to think it was all necessary. But of course, a few of us have raised questions. I know that, I've written 2 articles, one on public health ethics, another on medical ethics, and how a lot of ethical principles have been violated by the measures. So that's.
And what has the response been to those articles? Because I mean, I can tell you that in the United Kingdom, where I work, I've been publishing quite a lot, and but generally I'm greeted by my immediate colleagues by sort of silence. But how has that been in Kenya? I imagine not so much silence, but disagreement, or
well, I would say online I have had a few people engage me in discussions, and some have been extremely friendly and enlightening, but a lot of people seem to just not talk about it, not respond at all. I have also shared them with colleagues. I've shared my articles with colleagues. A lot of them just went quiet. But I guess there was a history, because at the beginning of the pandemic, as they call it, I questioned lockdowns and so on, and we had some exchanges sometimes that were not the most peaceful and pleasant. But that may have produced a history where people thought, well, let him alone, instead of actually focusing on the issues. So I think there is a lot of silence, but a few people are speaking. But I think one important thing that I must mention is that several people got together, not necessarily academics, just citizens, and filed petitions in the High Court. In the High Court, particularly against the vaccine mandate. There were several constitutional petitions, maybe 5, I haven't counted them. The court consolidated them, and the court processes are going on with regard to that.
So the court approved the litigants' case?
Yeah, the litigants' case, yes, it was found, they were found to have a case to prosecute, and in fact, all those preliminaries that go on with
yes.
Court cases have been going on. In fact, one of the mentions was yesterday. And the central argument is that the Bill of Rights is violated through an appeal to the Public Health Act. That the Public Health Act is a subsidiary legislation that should not be used to violate civil rights entrenched in the Bill of Rights in the Constitution.
Okay, well, so so people have spoken about that. Is the general response to what has happened? You mentioned silence broadly among colleagues, but I imagine that there's quite class-based, as you say, the middle classes who were able to work from home probably felt that this was protecting them.
Yes.
And so is that accentuated divisions in Kenya, or on in a class sense, or is that not a relevant factor?
I don't think it has produced a lot of division among the classes, partly because I am not sure that many people analyze things in terms of class. And a lot of people in our informal sectors went through what they went through. They didn't like it, but they did not necessarily mobilize to address it. So, so there hasn't been tension among the classes for it. I think it's just that now and then the underprivileged have spoken up and said they have been inconvenienced. And some of us who are not underprivileged but saw the injustice have also spoken up. But I haven't sensed any class tensions.
Okay. Well, look, Reginald, this is all, I think, very important. And just as we move towards the end of the discussion, we can talk a little bit about the future. I mean, I've sometimes referred to what's happened in the last 2 years, particularly with regards to the rollout of these policies on the African continent, where nobody who really understood what happens and the economy and daily life in Africa could think this was a viable policy.
Yes.
I've described it as medical colonialism. Do you think that's a fair description?
Yes, it is fair, and in line with V.Y. Mudimbe's observation that colonialism and colonization basically mean organization, arrangement, and the two words, he says, derive from the Latin word colere, meaning to cultivate or to design. And he goes on to point out that the colonialists and the colonizers rearranged. They have all tended to organize and transform non-Western or non-European areas into fundamentally European constructs. And I would say that has happened particularly the way in which the British colonizers almost totally dismantled indigenous health systems. Yes. They came up with a word, witch doctor, which is itself inconceivable. A witch destroys, a doctor heals. In Kiswahili, the two are totally different. Mchawi is a witch or a wizard. Muganga is a doctor. But because of the colonial propaganda, the word muganga, which is a doctor, even a Cambridge medical doctor is a muganga. But now that word has acquired terrible connotations, and our peoples continue to be robbed of their agency to take care of their health, which they took care of in these tropics and survived malaria and all manner of diseases. So yes, it is not just colonialism. It is, I call it public health imperialism. To get a few people in Geneva, Washington, D.C., and I don't know where else, telling everybody all over the world what to do, cannot be described as anything else other than public health imperialism.
And why did the Kenyan government and why did African governments agree? I mean, that's another very important question. Given that, as I say, nobody who understands the African context can possibly think this is a suitable policy.
Well, I think lives have been so interlinked, particularly because a lot of finances for public health is aid.
So there was a lot of pressure that I think, put on. Yes. Moving to the future, we've exchanged messages the last couple of days about the WHO proposed pandemic treaty. Is that a way of stopping this in the future, or what can be done to make sure that this kind of policy does not return?
In all honesty, what has happened was bound to happen because of the nature of the current global system, in which a few wealthy countries are able to dictate terms of engagement to numerous poor countries. Some scholars now make the important distinction between decolonization and decoloniality. What we had in the 1960s is decolonization. We got flags and national anthems, but decoloniality deconstructs the very structures of domination. Those remain intact. And therefore, sadly, I think that the future does not look bright. I think those who unleashed the terror on humanity, I have not heard them apologize. And with these latest moves, like the WHO convention, the future looks very bleak. And unless the peoples of the world force a discussion that addresses the fundamental issues, I think we're in trouble going forward.
Well, I have to agree with you, Reginald. We have to have a discussion. And one of the things I've found very upsetting, I will say, in the last year is, I've like you, we've been trying to have a discussion. And as you say, what we generally meet is silence. And we need a discussion in order to at least understand what is at stake for future societies. I mean, as a philosopher, as an ethicist, how do you feel that such a discussion can be produced or provoked?
I think that there is need for mobilization because I think there have been many things written, articles. I was just looking at your book yesterday, COVID Consensus. Not the book itself. I still don't have a copy in my hand, but I have seen several of these kind of books that are speaking up. But the trouble is, we are in a culture where people don't read as much. They would rather watch little clips on WhatsApp and put emojis of faces rolling and laughing than sit and do the hard reading. So we have to be creative to see how to actually engage them through short messages. For those of us who can read longer books, a book like yours, which I'm looking forward to reading, is a real boon. But for most people now, they need to be engaged in smaller packets of messaging. And also there needs to be more mobilization. And that is the kind of thing you and I as academics may not come to us naturally. And yet, if it is not done, I think the downward spiral will continue. And also, if we attempt to do it, of course, there is all this deactivation of accounts, whether Twitter or Facebook. So it's really an uphill task. I really can't say what's going to happen next.
One of the wonderful things that our producer does is cut out little excerpts so that we can have short bite-sized things for people to engage with on Twitter and social media, and that's great. But one thing I've also learned is how important it is to get back in the room with people. I think, face-to-face events and discussions, it's easy to ignore something when it's on a computer, actually, as we all know. But it's harder when it's in the room and somebody is discussing things with you face-to-face. You have to engage at that point, and I think that's vital.
Yes. That is true. I think the human contact is not replaceable.
No. Yeah. Yes. Well, look, Reginald, thank you very much for sparing the time and for some really fascinating and important observations. And we've never actually met in person, but I hope one day we will. Thank you very much indeed for your time.
Thank you too. It was nice meeting both you and Daniel, and I hope we shall keep in touch. I hope to get a hold of your book and really enjoy it. It looks interesting. Congratulations for it.
Thank you very much, Reginald.